This next lecture is going to be about prescribing resistance training exercise to improve and maintain muscular fitness. So, to get started, some of the benefits of resistance training that I'm sure you're all well aware of include improved muscular strength, improved muscular endurance, improved muscular power, um, also hypertrophy. So, the muscles tend to increase in size when you overload them. Other benefits, improved balance, improved coordination can result from resistance training, improved body composition, so generally an increase in lean body mass. Improved bone health, obviously, because you're stressing the bones anytime you put stress on the bones. And then just overall improved physical function, reduced morbidity, and I would also add in there enhanced quality of life. So, as far as modalities of resistance training, um, there's obviously free weights where you can use dumbbells or barbells. Uh, there's resistance training machines, as you can see like in this picture, a classic chest press machine that the individual is doing. Tend to be a little bit safer than free weights. Body weight exercises like squats, push ups, that type of thing. You could even add in suspension exercises like using TRX as part of that. Um, just classic bands and tubing that you can see that a couple of individuals in these pictures are using. So all these are different forms of resistance training. So this uh, figure from your textbook kind of outlines the different types of resistance training and some of the benefits and some of the drawbacks of each. So starting with body weight, obviously relatively safe, don't need any extra equipment. Some of the drawbacks may plateau easily because you can only weigh so much. Suspension devices, just like TRX, kind of the same thing, may plateau very easily. But again, relatively safe. Resistance bands and tubes, also relatively safe. Limited in how much resistance you can actually add, though, so that's one of the drawbacks. And then you get to the more of the classic types of resistance training using weightlifting machines and also free weights. So machines generally are going to be considered safer than free weights. Free weights, there's generally a learning curve to it, depending on what you're doing with barbells and dumbbells. Uh, so machines tend to be a little bit safer. You can limit the range of motion a little bit, and with machine using machines. However, they're generally pretty big, so they take up a lot of space, and also they're going to be really, really expensive to have access to weightlifting machines. Usually, need to be a member of some type of fitness facility. Free weights, again, you get a lot of benefits from free weights. Relatively safe when they are implemented and supervised correctly. So, using spotters when needed, knowing the movement, being comfortable and confident in the movement that you're doing. And one way to get around that is just obviously before doing anything, do few learning sessions if someone's not familiar with the movement, like if someone's never done a bench press before. Have them do a couple of sessions with just learning the movement, with just using the bar or even something lighter than the bar, just to kind of learn the correct movement. It tends to make it a lot safer and a lot more beneficial to the participant. So, getting into the recommendations for resistance training, a couple things. Obviously, the major muscle groups of the body should be targeted. Uh, Generally speaking, multi joint exercises should be performed, but single joint exercises are fine. Also, trunk stability exercises. But this get kind of ties into the order you want to do things. Multi joint exercises are generally going to involve more muscles, more muscle groups, so you're going to be able to push more weight, pull more weight with these multi joint exercises. So generally, it's recommended that those are done first before single joint exercises. And in a similar manner, large muscle groups are suggested to be done before smaller muscle groups. So a couple other little things: agonist versus antagonist. So agonist is the prime mover of a movement. So if you're talking about something like bicep curls, obviously the biceps brachii muscle would be the agonist, and the opposite muscle, which would be the triceps brachii muscle in that case, would be the antagonist. So point here is target both. So to prevent any muscle imbalances that might be present, you can say the same about like chest versus back, hamstrings versus quadriceps, etc. And then also movement should generally be through a full range of motion unless something's limiting the range of motion, injury or whatever. But again, you see this from your textbook, kind of the order. General rule of thumb, large muscles before smaller muscles, multi-joint before single joint. And then any trunk stability exercises could be done after that. As far as the frequency, so coming straight out of there is some variability here, but just looking at the general recommendations, 2 to 4 times a week. As far as recovery, 48 to 72 hours between bouts of resistance training for the same muscle groups. That doesn't mean you can't lift weights every day or multiple days a week. It just means for a given muscle group, you should allow them to recover at least 48 to 72 hours, especially when you're doing more heavy weightlifting. And there's a ton of variability here, and it really a lot depends on what the person's goals are and what their skill level is. But there's an option. You could obviously do all muscle groups in one session and do that 2 to 4 times a week. Or more than likely, as people become more accustomed to weight training, they involve some type of split option where they target 1 or 2 muscle groups per resistance training session, and then the next day target a different muscle group. And that way you could have like a 4-day sequence where you're doing different muscle groups. And then after that 4 days, you go back to where you started with whatever muscle group you started with. And by that time, it's fully recovered and ready to go. So being creative about what exercises are done or what muscle groups are done can help facilitate the implementation of these recommendations. And then the recommendations are going to be different from the average person who's just trying to stay in shape versus athletes who are competing in some type of event or sport. So a lot of this applies to athletes, but you could apply this to an average person who's just trying to facilitate their health and get in better shape. But this concept of periodization, it's basically developing an annual plan and then kind of breaking it down to smaller plans within that. So the terminology that's used in periodization includes macrocycle, mesocycle, and microcycle. So the time course of these can differ a little bit, but I'm just going to kind of give you what the average would probably be. So if you think of a macrocycle as being like potentially the entire year, if you're talking about an athlete, for example, there would be different phases throughout that year. So off-season, preseason, in-season, postseason. And that would, looking at the overall picture, and you can see it down here, that's what we considered a major macrocycle. Then within that, they would have these mesocycles, and on average, maybe about a month each. Could be a little bit longer, could be a little bit shorter. But based on the season, the changes, there are changes in the resistance training program. So you can see some of the key recommendations here, like early in the off season, you want to focus on more strength, endurance, and hypertrophy. Late in the off season, strength. Preseason, maximal strength and power. In season, you're just worried about maintaining it. So maintaining strength and power. Then postseason, where you need to allow the body to recover a little bit. So it's a lot of active rest. So those could be your mesocycles. And then a microcycle could be a few days or even 1 week out of the mesocycle, where you actually kind of alter the resistance training program to fit the overall scheme of that mesocycle. So you can alter the resistance, the sets, the repetitions, etc. So I kind of like how this picture right here lays it out. So you got a macrocycle, if you think about it as the entire year. The mesocycle might be the different parts of the seasons or parts of the year, and then the microcycles are within that. And then within the microcycles, you have your actual individual workouts that you're doing on a daily basis. So general recommendations for intensity. There's a few key things to point out here. But in general, as you're probably well aware, a lower load with high repetitions is better for muscular endurance. Higher load or higher weight with lower repetitions is more effective for improving muscular strength. as far as intensity goes, you can quantify it in a number of ways. The classic way to do it is just a percent of 1 RM. So again, as you are aware, if you don't have a true 1 RM, but you can do like a 5 RM or 7 or 8 RM, you can always estimate your 1 RM and go with that. So you can base it on a percentage of 1 RM. Could do something as simple as an RM each set. So basically find a resistance that is where you're going to basically fatigue at a certain number of repetitions. So you're doing like potentially like an 8 to 10 repetition max every set where you're just fatiguing at the end of the set. So that's a simple way to do this without worrying about any calculations. There's also similarly as many reps as possible. So AMRAP stands for as many reps as possible, just doing as many repetitions as possible. And obviously that means with good form. And again, that's trying to fatigue at the end of each set. You could use RPE if you wanted to, the 6 to 20, or for resistance training, to be honest, sometimes the 0 to 10 scale is used a lot. And then something that is also an option to think about, repetitions in reserve, which basically means how many repetitions you could do after a set. So in other words, if you did 8 repetitions, but you could actually do 10, you have 2 repetitions in reserve. So that's another option. Generally speaking, you don't want to go more than 2, but maybe 1. So you could do a set with a resistance where you think you could do 1 more repetition, but that would be about it. So that would get you to a pretty relatively intense workload. For optimal strength endurance hypertrophy, the general recommendation from the ACSM guidelines book is 67 to 85% of 1 RM. If strength is the goal, though, the loads need to be at least 85% of 1 RM. What I will say also about this, I've seen a couple of things. So I know it's saying 67 to 85% to target these strength endurance hypertrophy. I've seen as low as 60%. So as far as a cutoff, 60% is generally the minimal amount of resistance that you would want, or intensity that you would want, to improve muscular strength even modestly. As far as rest periods, it's something that is not talked about too much, but there are some general recommendations. So between sets of resistance training, it really depends on the goal. So if your target is muscular endurance, so you're using lower weight, higher repetitions, rest periods are recommended to be relatively short, so 30 seconds to a minute. And this could be almost like a classic circuit training routine that we're talking about. For most individuals, if the target is kind of the target strength, endurance, hypertrophy, 90 seconds to 3 minutes is a general range, and that's a pretty big range. And then for maximal strength and power, a little bit more rest between sets to optimize muscle recovery between sets, so anywhere from 2 to 5 minutes. And then these are the posted recommendations for the general population. I do like how in this edition of the guidelines they broke it into untrained, intermediate, and advanced. So again, this is not for competitive athletes who are participating in a sport. This is more so for the average person who is going to the gym for health purposes, increase functional movements, that type of thing. So again, completely untrained, as you could imagine. What you're trying to do is just get a good foundation. So frequency, anywhere in 2 to 3 days a week. Number of exercises, 6 to 10. So on the upper end of that, like 6, you might be talking about doing like a full body routine each time you go to lift weights, which is not uncommon for a relatively untrained person. Number sets, 1 to 2. People who are untrained, they can definitely see strength improvements with as little as 1 set. So it's for someone starting out, that's not a bad recommendation. And then repetitions, the standard 8 to 12 range. As you get to intermediate and advanced, you can see some of the changes. The frequency is generally going to increase a little bit. Number of exercises, at least here, is about the same. Once you get to more advanced, the number of exercises decreases, and that's more of a result of targeting specific body parts during a session. So let's say if you're going to the gym and all you're going to do that day. So an advanced weightlifter might say, I'm going to the gym and I'm going to work out my chest today. So they may have 4 to 5 exercises that actually target the chest muscles in different ways. And that's all they do. The next day they come back and do a different body part. As far as sets and repetitions, a lot of it depends on the goal. Generally speaking, if strength is the goal, lower number of repetitions, higher load. If muscular endurance is the goal, higher repetitions, lower load. And then for hypertrophy, it's generally somewhere in the middle, somewhere about that 8 to 12 range as well. And then for athletes, you can see a difference here. And it brings in what we talked about earlier with the periodization. You can see how it's broken into off-season, preseason, in-season, postseason, and the objectives are listed. Different types of exercises are listed, but I think probably more importantly, you can kind of see how the actual meat and potatoes of this changes a little bit. So the frequency tends to go down as they go into in-season, along with the sets, because remember, in-season you're just trying to maintain. And then postseason, you want the active rest. So a lot of the hard work that's going to be done with resistance training is going to be done in the off-season and preseason, where we can target strength, and you can see how number of repetitions are going to be relatively low when targeting muscular strength, whereas they tend to go up more for hypertrophy. And the rest periods can differ as well. All right, so the concept of progressive overload just basically refers to that you want to continuously, progressively increase the resistance that you're subjecting your muscle groups to, and they're going to continue to adapt for the most part. So generally speaking, ways to progress overload, obviously you can increase different aspects of the exercise prescription. You can increase the intensity by increasing the load. You can increase the number of repetitions. You could increase the number of sets. You could alter the exercises. But a couple of points I wanted to make here. General rule of thumb is when you can easily do your target number of repetitions, that's when you can increase the weight that's being moved. So a couple of things here. Small increases generally recommended. So a classic recommendation that's been there for a long time is 2.5 to 5% of 1 RM increases. And that would be like every 1 to 2 weeks. So relatively modest increases in intensity. There is this other method that I want to bring up called the 2 for 2 method. Basically means that you increase the resistance when you can do 2 more reps than the target reps for 2 consecutive workouts. So that means if you were, for example, your recommendation or what you were trying to do is do 8 repetitions of a given exercise. And you feel like you're getting stronger at it, and you do those 8 repetitions, and you could actually do 2 more. And you could do that for at least 2 separate exercise sessions at the gym. Then that's a signal that you need to increase the weight. So in other words, if you can do 2 more repetitions than you're normally doing for 2 consecutive periods at the gym, then that's when it's time to increase the weight. So the classic 2 for 2 method. Like I said, other things, increasing the sets, increasing the frequency potentially. You could also increase the range of motion of a certain movement, increase the speed if power is something that is important. And then again, just altering the exercises. A lot of us get in the same routine of doing the same resistance training exercises every time. So just altering those throughout the year, throughout the different seasons, that's also a way to kind of modestly involve your muscles, subject your muscles to progressive overload. So again, all of these are interrelated, so you got to consider what the goals are of the individual. All right, some other considerations, like I've said multiple times, there's an inverse relationship between intensity and repetitions. So higher loads, you're going to obviously do lower number of repetitions. As far as breathing, exhalation during the concentric phase of most exercise and inhaling during the eccentric. And exhaling through generally the most forceful part of a given movement. And a lot of people recommend exhaling through the sticking point of a given movement. Um, Minimizing the Valsalva maneuver. So breath holding, basically the Valsalva maneuver, straining, that type of movement, that type of activity is not necessarily recommended, but a lot of times it's useful in certain exercises. So doing the Valsalva maneuver, breath holding, what it generally does is stabilizes your torso. So in exercises like squats or other exercises where you're putting a lot of load on the body and it's stressing your torso and lower back area, the Valsalva maneuver can actually be helpful at stabilizing your torso and basically stabilizing your back. But it's definitely recommended not to hold a sustained Valsalva maneuver. So no more than, I generally say, a second, 2 seconds max of holding a Valsalva maneuver through the most forceful part of the movement, or the most taxing part of a movement. Other things, muscle soreness is going to be enhanced, especially in people who have never weightlifted before. So it's something to be considered. So, in other words, if someone's new to the gym, you don't want to give them a program where they're coming every day and doing a lot of really intense stuff. If they do have an intense workout, you give them time to rest a little bit, recover, and then come back, because there will be a lot of soreness. This is amplified by eccentric muscle contractions. So if you were like lowering weight really slowly, involving eccentric muscle contractions, that is going to increase the likelihood of muscle soreness. So something to consider, given adequate recovery time. And then also with the type of exercise you're doing, definitely utilizing help via a spotter, especially with the free weight exercises.